When choosing our careers, very few of us imagine ourselves risking our lives, and possibly that of our family members, to save a complete stranger. Yet, 2020 and the outbreak of the novel coronavirus has forced many medical professionals to make that choice. The pandemic even saw the need to get recent graduate doctors involved in helping to manage the day-to-day needs and requirements of patients. Today, I speak to one of these brave young South Africans to find out more about her experience. From being an intern, to serving the community, to being thrust onto the front lines of the COVID-19 pandemic. Ting-Ting, so very early into your career, you went from being a community doctor to being at the front line of the COVID-19 pandemic, basically overnight. Describe to me what went through your mind. What were your fears and your anxieties?
It's absolutely an unprecedented thing that happened, I think, not only to the healthcare system, but to the whole world. Naturally, the fears that came along was, how am I going to treat my patient in the best way possible? And how am I going to treat them in a third world country that has limited resources?
Since the start of the coronavirus outbreak, we've heard of many medical professionals succumbing to the disease. Is this a concern for you and your own health?
Yes, definitely. I think one of the important things that people forget, it's kind of a little pothole that society gets into, is that doctors are superhumans. And often we forget that they're just normal people. They've dedicated their lives to something that they want to do, healthcare. And it's not just doctors, but nurses and allied health sciences, where we have families and we have people who also are susceptible to the disease.
Now tell me, the Hippocratic oath taken by medical professionals has rarely been put to the test during this pandemic. What is it that makes you go back to work every day instead of walking away to protect yourself?
What makes me personally go back is realizing that everyone, the patients who come, they have no one to turn to. You are a healthcare facilitator. You facilitate their health and helping them realize that also that they need to take accountability for their own illnesses, and not that the doctor is just giving a magic pill that treats them.
What would you like the public to know about the bravery it takes for our medical professionals to report for duty every day?
Firstly, I want to say that the general public is so brave. We couldn't do it without you guys. And that every single health professional, I am so proud of them, and we are so grateful and humble to be able to serve, and to remember that you have to be kind to yourself, you have to be kind to each other, and to realize that the healthcare professionals, they're tired, they're really overworked, but they care and they're doing the best that they can. So thank you, everyone, and please keep washing your hands and keep looking after yourself. And remember that your cup needs to be full before you can fill somebody else's.
When you decide to pursue a medical career, it's safe to say that you're aware of the many, many challenges that come with the territory. But I believe few ever thought they'd find themselves at the coalface of a global health pandemic. Not just early on in their careers, but ever. Let's keep celebrating the brave health professionals who opt to put their patients first, day after day.